So our patient was turned off of gas anesthetic and was recovered in the operating room and extubated. Once they were extubated, they were carried into this room where we have some blankets, and we transferred the bear hugger from the operating table into here. Our patient was 94 degrees, and so we want to warm up our patient. We're monitoring temperature and along with things like heart rate and pain level. So we'll sit with our patient until they become more alert, ambulatory, and normothermic, so above 99 degrees. So while one or two members of your group sits with your patient, the other two can be cleaning up. They need to clean up the table in the operating room, disposing of disposables, putting laundry in the laundry bins, and then collecting the surgical instruments and washing them in the sink in the record room. Additionally, an operative report will need to be written, and so while we wait for this patient to recover, that's a good time to do that. And notes can be made on the anesthetic record as well. Now, additional analgesics, if they're part of your anesthetic plan, can be given at this time. That might include carprofen for a dog or robenacoxib if you have a cat. Our anesthesia staff may also recommend giving additional opioid medication at this time. And then later in the evening, on the day of surgery, you will be expected to come in and administer yet an additional dose of opioid analgesics. When you come in the evening, you will be expected to assess your patient, including a pain score for your patient, and then come to us with the drug that you would like to give and the dose that you would like to give. And if everything's appropriate, then we'll dispense that drug to you. Sometimes there are extenuating circumstances where we won't give an additional dose. For instance, if a patient is hypothermic or their heart rate is low or they're just not recovering as expected. When we transfer our patient back to either the dog room or the cat room, we remove the IV catheter and we place a small bandage with gauze and vet wrap around that area of the IV. You might also want to consider placing an e-collar on your patient, and those are located in the lab in the anesthesia induction area. Now is also a good time to write your operative report if you haven't already done so, and finish up your anesthetic record. In the evening, once your patient is more awake, you may give a small meal and have water available to your patient. And you can walk them at the time of your evening check as well.